Hello, my name's Dr Fabio Conti and thank you for joining me for this Carers Week video answering your questions on coronavirus. So thank you for all the carers who have submitted them. Let's get cracking. The first question is regarding immunity and whether, if you've had coronavirus, whether you can get it a second time. Now, unfortunately, we don't know the answer to that question. The things we want to know are, if you've had the infection, are you immune? And if you are immune, how long does that immunity last for? Now, until science has worked out the answers to those questions, the only way to protect yourself, your family, your friends, and your community is to follow the social distancing guidance. And that's whether or not you've had coronavirus before. The second question is how you differentiate a coronavirus cough from a cough caused by another reason. So the key thing here is if you've got a new and persisting cough. If you have those symptoms, it's imperative that you self-isolate at home and get tested. The reason for that is because it's really hard to tell what is causing that new cough. So you can get tested by going on nhs.uk/coronavirus or by calling 119. Now, what we do know is some people have chronic coughs, so that may be a cough that's been going on for many months or years. For example, in people who have COPD. Now, if you fall into that category, what you need to look out for is if your cough is changing. Is it getting worse? Are you becoming more breathless? If that's the case, like the others, you need to isolate at home and get tested. Now, for anyone with symptoms, if you're worried and you need medical advice, contact your GP, contact 111, or in an emergency, contact 999. Now, the next sets of questions were all about mental health and the impact coronavirus and the current situation has had. Now, I'm going to break this down. We've had some questions about accessing support and some others regarding autism and learning disabilities. In terms of generally, whether or not you've had anxiety or depression in the past, suffered with mental health problems, the current situation has put pressure on lots of people. Being at home for prolonged periods of time, not being able to see your friends and family. So if you are feeling down, if you're feeling anxious, get help. If, for example, you're already under a mental health team, contact them if you're feeling worse. If you've never sought help, you can contact your GP for support. We're here. It may be over the telephone, it may be by video, but we can still go through your symptoms and see how we can help. Additionally, there are a number of resources, both for adults and children, available in Hounslow that don't require a GP referral. For example, IAPT, our local counselling service for adults, or the Hounslow Youth Counselling Service. These are both resources that are available online, and you can contact them on the internet or by telephone. And what we'll try and do is put the links to those below this video. The next set of questions were regarding learning disability and autism, the impact that's had. One particular question was how many people have tested positive for coronavirus, have learning disabilities, and how many have died. Now, I don't have the specific numbers for Hounslow, but what we do know from a CQC report that came out recently, that was on the news this week, is that between April and May, many more people with learning disabilities died than they normally would in that same period in any particular year. Now, the key thing is often in people who maybe aren't able to express themselves very easily, sometimes it can be hard to pick out when the symptoms are first coming on. So if you are worried, if you are a carer, no matter how small you think the symptom may be, if you want advice, please do get in touch. You are the people that know the people that you're looking after the best. So go with your gut instinct. If you are worried, get help. In terms of, and also in terms of more widely about supporting people with autism, during this period of time, there are some resources online. If someone's under, for example, a learning disabilities team, if you are worried, please do get in touch with them. MenCap have a really useful page on their website with tips and advice for this period. So again, I'm going to try and publish that below this video so you can access those resources. The next question is regarding shielding, and someone who's received a shielding letter. They developed COVID-19 symptoms. Should they be continuing to shield? Yes. The key thing is, firstly, we don't know whether you had coronavirus. Even if you did, as I was talking earlier, we don't know if you're going to be immune from it. Therefore, it's vital that you continue to shield. I know the guidance has changed very slightly in the last week or so, which has meant that you are able to go out for a walk with someone from your household or with one other person as long as you maintain social distance. But please do shield, because if you receive one of the shielding letters, it's likely that you are in one of the categories that puts you most at risk if you were to contract COVID-19. So therefore, continue shielding until the advice changes. Now, the final two questions were about accessing services and how primary care is working. The first is regarding using technology and how more consultations are happening by video, and whether there's any plans to support patients buying smartphones, and whether there's any training on using the software. So, I know day to day, a lot of our consultations are by telephone, we're doing some by video, and it's a really great way of interacting with patients, seeing, for example, rashes, etc. So, it is helpful. It's quite a simple program that most practices are using. It's something called AccuRx. Essentially, I've used it multiple times, a whole range of patients. I can't think of a particular case or occasion where a patient I want to use it on couldn't get it to work. So it involves clicking on that. You receive a text from the GP with a link. You press on the link. It will then say, "Will you allow camera and microphone access?" You click yes, and then it's working. So it's really a sort of two-click process. Usually the GP, as I do, will just explain to the patient that they're going to get a text. You have to click on the link. And like I say, it's a really simple. So I don't think there's any specific training. It's not like Zoom. It's not like Microsoft Teams, which can be quite complicated to use. You need usernames and passwords. So if you do have the opportunity to try with your GP, please do. And don't be frightened about using it. It's not complicated, and sometimes it can really help in consultations. In terms of people not having smartphones, yes, we are totally aware that not everyone does. And clearly, talking over the telephone is really helpful, because what's really helpful for us, even before examining a patient, is getting that history. So talking to the patient or their carer by phone, and then we are still bringing patients into the practice if they need to be examined. And if we feel that someone needs to be seen and they don't have a video, then of course we can always arrange a face-to-face appointment. And the final question is about carers and how some GP practices have been doing an excellent job in contacting carers and patients to see how they're doing during the lockdown. And some other GP practices, some other carers have felt that their GP practices haven't been in touch. Clearly it sounds like there's been different experiences, and that may be due to lots of reasons like staffing, etc. But it is so important that we keep in contact with our carers, because it is a really tough time when you're in lockdown. You're especially if you're shielding, you're isolating at home now for into your sort of third month of doing that. So if you have concerns and if someone's not been in touch, please do get in touch with us, and I'll feed back those comments to the CCG so that we can see what else we can do so GPs can support you and the people that you're looking after. So that takes us to the end of the video. Thank you again to all the questions that have been submitted. I hope you found that helpful, and I hope you enjoy the rest of the resources that are available on the website for Carers Week. Thank you.